Planks can be a great core exercise, but if you have arthritis in your knees or wrists, if you have shoulder pain, or if you have difficulty getting on and off the floor, then you may find planks difficult to do. I'm Dr. Dave Candy, and in this video, I'll show you 7 senior-friendly versions of the plank. I'm going to show all of these exercises on the floor. But keep in mind, if you can't get on the floor, you can just as easily do these exercises on a bed. However, I'd suggest if you have the ability to get up and down from the floor, that you do the exercises on the floor. Because if you get on and off the floor regularly, you maintain your ability to get up and down from the floor. Now for the first exercise, you're going to be kneeling on your knees. But if you have trouble kneeling on your knees, you can use a rolled up yoga mat like this as padding. You can use it straight out flat the way you would normally use a yoga mat, but by rolling it up like this, you give yourself a little thicker padding. To do this, you're going to kneel on the yoga mat, but not with your knees directly on the yoga mat. You want the mat just under the top of your shins so that your kneecap is hanging a little bit off of the front. This way your pressure goes through the shins rather than through the knees. Then you're going to come out onto your forearms, and you want your shoulders to be directly over top of your elbows. If your shoulders are too far in front or too far behind your elbows, you're going to have to use your shoulder muscles a lot more to stabilize. So try to get as vertical of a line from shoulder to elbow as you can. Now you want to maintain a direct line between your shoulder and your pelvis. Ideally, you want shoulder, pelvis, knees, but that may not be possible, especially if you have tight hip flexors. So tighten your tummy muscles and flatten your lower back out. Then squeeze your bottom muscles or your glute muscles to try to push your hips as far down towards the floor as you can without allowing your back to arch. So again, tighten your tummy muscles, get your lower back flat, then squeeze your glutes. And just push your hips down towards the floor like this. And then try to hold this for at least 30 seconds if you're able. Ideally, the goal is to work up to being able to hold each of these positions for a minute or more. But you may not be able to do that initially. So just start out with what you're able to do. It's also important that you maintain good technique. So if you start to notice your back sagging down, reset, tighten your tummy, flat back, squeeze the glutes to push your hips as far down towards the floor as you can, even if you're not in a perfect line from shoulders to hips to knees. So that's the first exercise. For the second exercise, you're going to come down to a push-up position, and you're going to hinge through your knees. So this is going to be a modified push-up where you're tightening your belly, coming up like this into a high knee plank, and then coming back down. So it's actually both a core exercise, keeping your tummy muscles tight again, and using your arms to strengthen your arms at the same time. This is good for people who have osteoporosis or osteopenia because weight bearing through your arms actually helps to build bone density. So start in a push-up position, tighten your tummy muscles to flatten your back, push up, and then come back down. And try to do 10 repetitions of push-ups, working up to more if you can. Next, we're going to move up to a full plank exercise. So you won't need the yoga mat for this one. You can roll it out straight and use it like a regular yoga mat. I'm not going to use it to demonstrate. So start out in a high plank position like this. Again, you're going to tighten your belly, squeeze your glutes, and push your hips down from here. Now this version does require a little bit more upper body strength. So you will need a little bit more strength in your shoulders. If you can't do this, just start with the first 2 versions and then work up to this. It also requires more wrist extension mobility. If you don't have enough extension in your wrists, you may find this difficult to do. There are a couple modifications that you can make. You can do it from your wrists. I would recommend using a mat if you're going to put your knuckles on the floor just to make it a little bit more comfortable. and holding in a position like that. But that's also hard on your hands if you have arthritis in your fingers. Additionally, you can do this exercise that you see over here in order to help improve your wrist mobility. And after doing that, you may find you have a little easier time getting your shoulders directly over top of your elbows and wrists. Then again, you want to tighten your tummy muscles, get a straight line from shoulders to hips, lower back relatively flat, then squeeze your glutes and push your hips down. Again, don't allow them to sag down like that. So get the trunk straight, squeeze the glutes, push down as far as you can while holding your tummy muscles tight. And again, try to work up to holding this for 30 seconds to a minute if you can. The next variation is going to be from that upper plank position, but going into a full push-up. Again, this is a great upper body strength exercise, but you may not necessarily have the ability to do this straight off. It is important when doing a push-up, particularly a full push-up, to have a good alignment between your wrists, your elbows, and your shoulders. Many people will do push-ups with their elbows kind of flared out to the sides, like that. And that is a better chest workout, but it is a little bit harder on your shoulders. So try to squeeze your elbows inwards. That puts your shoulder in a position of external rotation. So hands under shoulders, squeeze the elbows together, and then do push-ups. And again, do as many as you can comfortably, trying to shoot for 10 or more. For the next exercise, you're going to go back into that plank position, hold it tight, and then extend your hip a little bit like that. When you walk, you have to be able to get hip extension, but you don't want back arch when you do hip extension. So make sure you're doing a slight glute squeeze, hip extension, small hip extension. Notice this is a very tiny range of motion. And again, if you have stiffness in your hip flexors, you may find this fairly hard to do. So don't do it at the expense of arching your lower back. Make sure you're able to maintain good technique, even if you barely lift the leg. And if you can't get to that one at all right now, that's okay. The next variation is going to be coming back down onto your forearms, but then up on your toes. So instead of the initial exercise where you're down on your knees like this, you're just going to come up this way. This is actually a little bit harder of a core strength exercise than a full plank where you're up in a push-up position because you're more horizontal or parallel with the floor or perpendicular to the downward force of gravity. And that means your trunk muscles have to work a little bit harder, even though it's not quite as hard on your arms. So again, stomach tight, squeeze the glutes, push down into a plank position. And this is actually a fairly difficult core workout. From here, if you're able, you can do, again, just slight hip extensions. And that's the last exercise. And again, because you're starting from more of a hip extension position down here, that's quite difficult to lift the legs like that without extending your lower back. So those were the 7 senior-friendly plank exercises. Now keep in mind you can do all of those on the bed if you can't get up and down from the floor. Additionally, if you'd like some other core strengthening exercises, check out this video over here, or to learn more about proper push-up technique, check out this video down here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.